The Oncotype DX colon cancer and breast cancer assays are different in the sense that they look at different genes. And one of the things that's really important to think about when we look at breast cancer or colon cancer, and now we're of course looking at prostate cancer as well, is it gets at the very core of why we are talking about personalized medicine, is all cancers are not driven by the same genetic or genomic profiles. And so what we did with the breast cancer test starting is we asked ourselves a question: could we figure out who are those good and bad actors that come to the party? You know, what are the good genes and what are the bad genes playing out in breast cancer? And so we started with a number of genes in breast cancer. It was several hundred genes that we looked at, and we actually said, okay, we could identify a number of genes, hundreds of genes that looked like they were impacting breast cancer, and then we actually pared that down to what we thought the most important genes were. And what you end up with is a situation where you're looking at expression levels of those genes, or we're looking at RNA expression with the Oncotype DX assays, and we're looking at overexpression and underexpression of genes. And so with the breast cancer test, we ended up looking at 21 genes, and that is then put into an algorithm. An algorithm is developed, so the combinations of those genes, whether they're overexpressed or underexpressed, then produces a recurrence score. And it's the same thing with colon cancer, except it's a different number of genes, and they're different genes. And one of the things that is at play here is that you can see different pathways have a different impact in different cancers. And what we have shown in both breast cancer and in colon cancer, and we will show it, we hope, in prostate cancer as well, is a number of pathways has always been more powerful than just looking at one pathway or one gene alone. So in breast cancer, it's 21 genes. In colon cancer, it's a different set of genes. And in prostate cancer, it will be yet another set of genes that gives a patient a recurrence score that they can then use to predict their likelihood of disease recurrence. In an early stage breast cancer that's invasive, that likelihood of recurrence we can then associate with a response or not to chemotherapy. The DCIS score that we developed is the same recurrence score. It's the same set of 21 genes as the invasive breast cancer score. But it's looking at an earlier stage of breast cancer, and it's looking at whether or not that disease is likely to recur over a period of time.